Hi, my name is Mitch Fulton, and I'm a PhD student in the Advanced Medical Technologies Laboratory at the University of Colorado Boulder. Today, I'll be presenting our research on deformable Bayesian convolutional networks for disease-robust cardiac MRI segmentation. First, let's talk a little bit about the motivation behind this research. Cardiovascular disease, or CVD, kills 18.6 million people worldwide every year, making it the #1 cause of death. As it can often be managed with early detection and good access to healthcare, these diseases mainly affect low and middle income countries. Many CVDs are diagnosed by having a physician or radiologist manually segment MRI, CT, or ultrasound scans, and an automated segmentation process could save both physicians and patients time and money. To be effectively deployed to all patients across the world, this technology must be able to generalize well to all patient populations without using extra training data. To support this endeavor, the MNIMS2 competition dataset was introduced. It's a dataset of MRI images composed of patients from across the world with different heart diseases. The goal is to segment the right ventricle in both 3D short axis and 2D long axis scans for patients with 8 different categories of heart disease. These segmentations are then scored with a weighted combination of the Dice coefficient and Hausdorff distance for both the short axis and long axis scans. However, as you can see in this table, only 6 of the diseases are present in the training set. So the main question to consider while training is, how do we focus only on important areas of the image while learning to generalize well to other diseases? We answer this question with deformable Bayesian convolutions, or DBCNs. To create DBCNs, we combine the flexible sampling of deformable convolutional networks, or DCNs, with the generalizability and quick learning of Bayesian convolutional networks, or BCNs. The equation is shown here, with DCNs replacing the convolutions representing the mean and standard deviation of BCNs. This new formulation allows DBCNs to have the benefits of both deformable and Bayesian convolutions with focused receptive fields and more generalizable weights. Or, represented visually here, DBCNs first calculate offsets for sampling, then learn weight distributions corresponding to each of these offset sampling locations. These convolutions can replace any standard convolutions to help improve generalization ability, making them an easy addition to any network. Therefore, to implement DBCNs for the MNIMS2 challenge, we simply replaced a convolutional layer in the existing medical segmentation network nnUNet. nnUNet was used to showcase our DBCNs due to its impressive first-place performance in the first MNIMS challenge. We simply replaced the convolutional blocks in the lowest layer with our deformable Bayesian convolutions, or the layer circled in this UNet model. Then we used the same data augmentation and 5-fold cross-validation as the nnUNet attempt for the first MNIMS challenge, with an additional KL divergence term added to the loss function to help train the DBCNs. We then ran 3 initial experiments before our final test submission. The first was altering the number of labels used for training. The second, altering the number of epochs during training, with an epoch defined as 250 batches due to patch-based training. Finally, we altered the network size, comparing networks with either 2 or 3 convolutional blocks per convolution layer, with an increased maximum number of features in the 3x network. We then submitted our final results determined by this initial testing. The training data provided for the competition had 3 areas of the heart labeled: the left ventricle, myocardium, and right ventricle. But for the final testing, only the right ventricle segmentation was considered. As we used different networks for the long axis and short axis scans, we were able to test the number of labels individually for each network. For the long axis scans, we found a significant training performance increase when we trained with all 3 labels over just the right ventricle, likely due to overfitting. However, when we trained the short axis scans, we found an increase in training performance when only using the right ventricle segmentations. We then did the rest of our experiments and training using these labels for each network. To test the effect of training length on performance, we trained one fold of our networks between 100 and 1,000 epochs. The best 4 networks were then trained for the full 5 folds and run on the validation set. Their results are shown here. As you can see, when the training time is low, the performance is not bad, but the training is not indicative of the validation performance. This indicates the network is not fully trained. When trained for the longest period of 1,000 epochs, there's a slight decrease in performance or no further increase, indicating the start of overfitting. Therefore, we chose to train the rest of our networks for 600 epochs. After we examined our training length, we altered our network sizes to see how it affected the network performance. While the 2x and 3x networks produced similar results in training, the validation results were very different. For the short axis scans, we found that the larger 3x network yielded better validation results, while the opposite was true for the long axis network. However, when testing our final models, we found the opposite results of the validation scores. Likely this is due to the non-uniform sampling of different diseases in the testing set. The validation set has 5 scans from each category, while the test set has varying numbers from each, focusing especially on the unseen categories and disease-free patients. Therefore, we used the 2x short axis model and the 3x long axis model for our final submission. Broken down by disease category, notice that the 3x network used for the long axis scans has better results on the previously seen categories. We believe this is due to the tendency of a higher number of standard convolutions to overfit to the training data. Likewise, the 2x network for short axis scans performs better on the unseen categories. We believe that since this network has fewer standard convolutions, it has better generalization capabilities despite underperforming slightly on the seen categories. In conclusion, DBCNs are an effective way to increase the generalization performance of a network with a simple drop-in replacement for any standard convolution. While the generalizability comes with a small decrease in performance for intra-domain tasks, we believe that DBCNs are a good addition to any existing network to help combat the over and underfitting present in many machine learning networks today. In the future, we hope to apply DBCNs to other applications in other network configurations and use the confidence levels inherent in the Bayesian convolution formulation to further improve our performance. With that, I would like to show the references used in this paper and for this presentation. And I would like to thank my lab and our funding sources for supporting this research. If you have any questions, please email the contact information shown or visit our website. Thank you.